Good morning, good afternoon, good evening. This is Dr. Garais, and this is BIO112, Anatomy and Physiology 1, Laboratory, and we're doing Unit 4, and that's the eye and the brain. So, what are the structures do you need to know in the eye? Okay, right there. So, cranial nerve 2, you need to know that. And, of course, let's look at the external structures first. The white part of the eye, not necessarily these arteries and veins, but see this white part, or the tough outer layer, is of course called the sclera. And I got the words back. The front part of the eye is the anterior chamber right here. And that has aqueous humor. And that little bubble that you see there, that is your cornea, which is continuous with the sclera. So they have like a outer protective function. But the sclera is, of course, the whites of your eye, and the cornea is this transparent protective bubble out here. The colored part of your eye, right there, that is the iris, and of course the pupil, the opening is in the middle. Now, you're not really responsible for, these other tools, but if I do this and pick this button, I'm going to remove the layers. So I remove the sclera, and the layer that I have next, right underneath there, that's the vitreous body. So that's one question I could ask on the Anatomage checkoff. What kind of fluid is in the posterior chamber of the eye? And you'll tell me gel-like fluid called your vitreous humor. Remember, humor in Latin means liquid. So right here, vitreous humor. But in the anterior chamber, which is the front part of the eye, that is the aqueous humor. Remember, A for aqueous, A for anterior, and vitreous is the exact opposite. Now, again, I hit this tool, hit this button, remove the next layer, and the next layer is the choroid. So the outermost layer is sclera, the middle layer is called the choroid. The middle layer of the choroid has all the vasculature that will feed the eye. And that's what's important about the choroid. I remove the choroid. I will now have the retina. The retina is the inner neurologic layer, and that's where it has all the rods and cones, except for this location right here, and that is your optic disc. If I then remove this layer, then we can easily see the lens, three structures. Here, the lens, oopsies. Let me get it back. Here, the lens. See those little, these little sticks or these little wires that are holding up the lens? That's your suspensory ligament. The suspensory ligament is then connected to this muscle here called your ciliary body. The function of all these three things is also to help what? Help the lens refract light so that it comes back to the back part of the eye, which is the retina. Okay, I'm bringing back all structures. Because the next thing I could also ask is, we could talk about, well, I won't really ask about this too much. But this was the experiment in the laboratory that we were looking on the different parameters, and we were looking at this chart, the Snellen's chart. But more important for the Anatomage checkoff is, let me remove this, is this part right here, the extraocular muscles. Now, we're looking at the eye like this. This is your patient's right eye, right? If I click on this, it'll say, I removed right versus left, but this is the right eye. So if this is the right eye of my patient, this part here where this little menu is, that will be where my patient's nose is, or the medial side. And then the exact opposite is the lateral side. Up here, superior. Down here, inferior. So you have four muscles that are straight, the rectus muscles. There are 6 extraocular muscles in total. So the one straight muscle on the top has to be the superior rectus. The one straight muscle on the bottom has to be the inferior rectus. And since this is the right eye, if I'm looking towards the right, my patient's looking towards the right. Remember, the perspective is always at the patient. So if I'm looking right at the patient, this is their right eye, and this is the right side of their face. So if I'm looking over to the right, that's your lateral rectus. And if I'm looking to the left in my right eye, towards the nose, that has to be the medial rectus. So superior, inferior, lateral, and medial rectus, those are the 4 straight muscles. And now you have 2 muscles. You have your superior oblique, right? You could see how it's very different, how it's kind of curvy. And then your inferior oblique, you could see this one's like running diagonal instead of what? Straight, like the rectus muscles. And we could ask you, what muscles are required to move my eye to the right? And of course, that will be your lateral rectus. What muscle is going to require my right eye to look to the left or towards the nose? That is the medial rectus. Goes what muscle that's going to require moving my eye up or looking up? That's got to be the superior rectus up here. And then what's required to move the eye down? That's the inferior rectus. And then the inferior rectus, it's going to move, you see how it rolls my eye down and to the right, which is my right eye. And then my inferior rectus is going to roll my eye up and to the right. So need to know your extraocular muscles and identify your extraocular muscles. That's also for the eye. Also for the exam, I put a little diagram there on cranial nerve 3, 4, and 6 on which ones supply which muscles. And the key to that is cranial nerve 3, 4, 6, solar. So cranial nerve 3 is the majority of the muscles. Cranial nerve 4 is SO, right? So cranial nerve 4 is superior oblique, and cranial nerve 6 is LR, lateral rectus. Okay, that's a nice little hint. Now, we will now go on to the brain. Now, the first thing we always have to do when we're looking at any anatomy is I have to know the orientation. So where's front, where's back? If you notice this here, right, the pons and midbrain are kind of slanted towards the rear, right? That means this has to be the front, okay? And if you look at it from this side, you can see it's now slanted this way. So that means this is the back and this is the front. So look at that before you answer any questions. Now, let's go over the structures that you need to know. Inferiorly, you need to know the pons. You need to know the midbrain. Right above the midbrain is this like donut-like thing right here, and that's your thalamus. Right underneath the thalamus, hypothalamus. The Nike swoosh, right, is your corpus callosum that connects the 2 hemispheres. Right above that is your cingulate gyrus, which is heavily involved in your limbic system, or the system that deals with emotion. If we're now looking at the pons and midbrain angled this way, that means this is the back, this is the front, though this has to be the frontal lobe, parietal lobe, and then occipital lobe. Now, the temporal lobe can't really be seen here on this view, but if we turn it around, get rid of all these annotations here. If we turn it around, you see the frontal is red, parietal blue, occipital green, and this area right here, right, is of course your temporal lobe. Okay, those are the 2 things you need to know for Anatomage for Unit 4. And remember, Unit 3 is muscles. For overall, for the final Anatomage, you will need to know the superficial muscles that are discussed and listed on the form, and it's already in announcements. But remember, in announcements for BIO112L, L for laboratory. And then, of course, Unit 4, eye and the brain. All right, see you in lab. Good luck.